Good morning. Thank you all for being here. Before we get started, I just have a few housekeeping items that I want to cover for you. My name is Sarah Ziegler. We're all very excited that you're here. Just want to review some of the security procedures for you, just so you are aware that to ensure your safety as guests at CDC today, please make sure if there is any emergency that you rise from your seats and proceed to the nearest exit. Those are behind you. Please do not run. Upon exiting the building, assemble on Michael Street, which is the street directly behind this building. You can locate the space to gather. If you have to exit, there'll be signs there, conference and meeting space. And please group together so that you can be accounted for, and when the all clear is indicated, you can return to this building. We'd also like to ask you to please silence your cell phones and Blackberries if possible for this session. And I also wanted to point out that everyone should have a folder for participants. And in that folder, you have biographies of all of the speakers for today that you can refer to as needed. And in addition to that, we've included a note-taking form for those of you, especially for people that are going to be participating in the action planning sessions this afternoon. You can use those note-taking forms to jot down ideas and different great ideas that you think of as the talks are being offered this morning. You may need to refer to those later this afternoon. And with that, I would like to introduce Dr. Tom Frieden, CDC's director.
Welcome to Atlanta. Welcome to CDC. Thank you all so much for being here. This is a really important day, and welcome not only to those of you in the room, but to the more than 1,500 of you watching on webcast. I want to give a special thanks to the White House for their leadership and support, to the Department of Health and Human Services, and to our many U.S. government partners. You've seen a list of them. This really has been a whole of government and a whole of society response. I also want to thank the state, tribal, local, and territorial health departments, many of whom are really on the front lines of this struggle against Zika, and with whom we have a tremendous partnership. Also, non-governmental organizations have been crucial to every aspect of our response and will be crucial going forward as well. And a key reason this summit is possible is because of support from donors and partners who agreed with us that it's a critical need at this very time for the right leaders, experts, and sectors to get together to address this threat to health security. Their support and partnership is essential, and it will remain essential in the response. Our sincerest thanks are due to SC Johnson, Bayer, and the CDC Foundation for helping to support this summit. CDC works 24/7 to protect the health, safety, and security of Americans. We can't accomplish this without work from throughout the agencies, throughout the government, throughout society. And for that reason, I really appreciate all of you taking time out of your busy schedules to be here today for what I believe will be an effective working meeting to advance progress against Zika. Zika is the latest in a series of unpredicted and unpredictable health threats. What is predictable is that there will be more health threats, and the better prepared we are, the better we can protect Americans and others around the world. We have literally been learning more about Zika every single day, but the fact is there's still a lot we don't yet know. There's also been an enormous amount we have accomplished in our efforts to confront Zika. The fact is that there is an enormous amount more yet to be done. The most urgent imperative is to reduce the risk to pregnant women and their developing fetus. And that's the overarching frame by which we make our plans, we make our actions, we focus our research, we focus our activities, and we keep ourselves motivated. Zika is already in the U.S. and territories. It's already affecting hundreds of Americans who've traveled to Zika-affected places. It's already spreading widely in Puerto Rico and elsewhere in the U.S. territories. We expect it to continue to spread. Mosquito season is upon us. We cannot predict what the exact future of Zika will be. We do not have a crystal ball, but we can tell you what science suggests it may do based on other similarly spread vector-borne diseases. And that could include thousands of travel-associated cases in the US, hundreds of thousands of cases in Puerto Rico, and now we're learning some sexually transmitted cases as well, anywhere where Zika is spreading, and possibly clusters of Zika in areas of the US which have competent vectors, particularly Florida, Texas, Hawaii, and potentially elsewhere. You'll hear today more about what we've learned and what we know and what we don't know. This has a lot of implications for what we do. You'll also hear about best practices in a variety of areas, best practices in tracking human disease, mosquito populations, birth defects. We'll also hear about important gaps and ways that we can work together to fill those gaps. We're here together for an important reason. We must work at all levels of government and all through society to reduce the risk to pregnant women, to effectively combat the Zika threat. At the same time, we need to think of the bigger picture. President Obama, in our first briefing on this, urged us to think systematically and not just episodically about mosquito-borne and other crucial threats facing this country and the world. We need to ensure that we come out of this not just with reduced impact of Zika, but also with sustainable mosquito control infrastructure, with improved surveillance, with improved partnerships within the government and between government and civil society. I look forward to working with you, to hearing what's said, and even more, to further accelerating progress in the weeks and months to come. But first, I'd like to introduce a few other speakers to welcome you here today. First, I'm honored to introduce Amy Pope, White House Deputy Homeland Security Advisor and Deputy Assistant to the President. Amy?
Good morning, everyone. I am just thrilled to be here with all of you, those of you who are real experts in this field at all levels of government, our states, our local, our tribal, our territorial partners, the private sector, non-governmental organizations, to advance our whole of government, as Tom said, really our whole of community effort to fight this disease and the mosquito that spreads it. I'd like to thank Dr. Tom Frieden, who's been a real partner here, and the CDC for hosting the summit, and the CDC Foundation for bringing together this event really in such short order. And I'd like to thank our partners at the National Governors Association, who too realize how important this is that we all work together on a solution. Thank you for joining us in this effort. I serve as the President's Deputy Homeland Security Advisor on the National Security Council staff. Some days, I think of it basically as being a Girl Scout. If you know the Girl Scouts, the motto is, be prepared, and that's my job. My job is to make sure that we as the federal government are as best prepared as possible for whatever threat is coming our way, whether it's a hurricane or a tornado, whether it's a terrorist attack on the homeland, or whether, as we've seen now in a couple of different instances, an emerging infectious disease. I also serve as the Ebola response coordinator at the White House, and I can tell you from serving in that role, from watching what Ebola did here in the United States, the number one lesson that I've learned is that if we wait until we see widespread transmission in the United States, if we wait until the public is panicking because they're seeing babies born with birth defects in every state or across the country, we have waited too long. And our number one job here today is to make sure that we get ahead of that we can confidently say to the American public that we are prepared to take this on. And that's why I'm here today. Now, as Tom said, we've been tracking the spread of the Zika virus in the Americas for some time. And on a very, very snowy day in January, in fact, we had the federal government was closed, the president convened his national security team and his public health team, and he asked us to brief us on what we knew about the spread of the virus. And even though we were months away from anyone getting a mosquito bite, in fact, we're more likely to get frostbite by having to go out on a snowy day and make it to the White House, The President charged us with significantly advancing our efforts to fight Zika, to accelerate our research, to develop vaccines and diagnostics, and to make sure that all Americans have the information that we need to protect ourselves and keep ourselves safe. So that's why we've invited all of you to join us here today. We know that to take on Zika, we cannot do it alone. The federal government cannot be the only actors in this space. We need the expertise of this entire community. We need the expertise of sanitation workers, of local gardeners, of obstetricians, of public health officials, down to the disease detectives who are now working today in Brazil. We know that every single person here has a piece of the solution, and we know that every single person here has a vital role in implementing that solution. Now, as Tom said, there's still a lot we don't know. We don't know the exact correlation between the Zika virus and birth defects. We're still learning about the association of the disease and Guillain-Barré syndrome. We've not yet identified a vaccine candidate, but I can assure you that we are devoting significant resources to closing these gaps. Following that snowy January meeting, President Obama has made agreements with the leaders of Colombia, with Brazil, with Cuba, with Canada, to advance our understanding of the disease, to work together, and to better understand its impact on human health. CDC disease detectives right now are in places like Brazil, Colombia, working with their counterparts in South America to get the vital answers that we need to solve this problem. And I will commit to you that as we get that information, we will be sharing it with you. And to support these efforts, in February, the President submitted an emergency supplemental request to Congress to fund approximately $1.9 billion to support our preparedness and response activities. Things like accelerating vaccine development and diagnostics, things that will impact all of us here in the room. And importantly for all of us, that request contained over $450 million for domestic response activities, which will help states fund their vector control efforts and their emergency response. We've asked Congress to act swiftly on this request to make sure that we are prepared to respond to Zika in the homeland. Now, our request for funding is still pending, and we hope Congress will act soon. But in the meantime, we cannot wait, because there is a lot we do know, and it's absolutely critical that we share what we know to get to the best results as quickly as possible. We know that most people won't suffer a significant illness. 4 out of 5 people don't actually show symptoms. But as Dr. Frieden said, we do know the impact on pregnant women can be devastating. And that needs to be our #1 priority. And most importantly, what so many of you sitting in this room know is how to limit the spread of this mosquito. Many of you in this room have very valuable experience doing just that, whether it's limiting the spread of the dengue virus or West Nile disease. There is a lot of experience in this room on how to encourage communities to take common sense measures to protect themselves from disease and to limit the places where mosquitoes can breed, for example. And the goal of today's meeting and the goal of this coalition is to make sure that there are no barriers to sharing this information or to protecting Americans based on the very best evidence we have, no matter who has that evidence. When we launched this coalition back in February, we set up 3 goals for ourselves. First, we need to enhance our mosquito surveillance and vector control. Second, we need to improve our diagnosis and our ability to report Zika virus across the country, which can help us identify where that mosquito is spreading and where the infection is being transmitted. And third, we need to launch a public awareness campaign. We need to engage the public, healthcare providers, women, and partners, focusing on making sure that they can take the steps they need to protect themselves when they're pregnant, and to involve citizens, community groups, local governments in our mosquito population control activities. Now, I'm a mom myself. I have 2 girls. I'm active in my mom's organizations where I live. I know the power of the voice of moms. Get moms engaged. Make sure they're speaking to Congress. Make sure they're speaking to their local community members. make sure they understand the impact that this disease could have on them and on their friends. Now, we don't yet have all the tools we need. We don't have all of the rapid diagnostics we need or the vaccines or even the next generation vector control options. But when we come here together, as we're doing today, we have a very powerful tool to combat this threat: preparedness. Use today to build your action plans, to enhance your own networks, to learn from the knowledge of the people who are sitting around you today. Be prepared. And together, we will zap Zika. Thank you.
Finally, I'd like to introduce Dr. Nikki Lurie, Assistant Secretary for Preparedness and Response at the Department of Health and Human Services. Nikki?
Thank you, Tom. Thank you, Amy. And thanks to all of the CDC staff who made this possible, to the CDC Foundation, and to all of you for being here. You know, I think when this was a twinkle in the eye of its originators, nobody really imagined a room full of people here and an incredible overflow room and webcast around the country. So it's just terrific to see all of this here. I hope today will be a very strong resource for you as you refine all of your Zika preparedness plans. You just heard about preparedness from Tom and Amy, and today is the day to really bring together leaders and key stakeholders from across your states to give you an opportunity to see each other out of your home environment here and to be sure that we are all planning and ready to respond to Zika in your jurisdictions. Not when it gets there, but so it doesn't get there. And so if it does get there, you are as proactive as possible. As I think you all know, with the emergence of Zika in the Americas in general, HHS has taken a proactive and, as scientific evidence has mounted, increasingly targeted action to protect the American people. Long before there was even a travel-related case of Zika in the United States, as you hear, the president pulled people together to talk about how to be proactive. At HHS, we also pulled people together to be sure that we were working in a proactive and coordinated way, and we've continued to do so. Our understanding of Zika, as you all know, is still evolving. And we know from previous infectious disease crises, including West Nile virus, H1N1 pandemic flu, and Ebola, that an effective preparedness strategy requires collaboration across all sectors and across all levels of governments. When it comes to hurricanes and tornadoes, I think you're used to hearing that term, whole community response. This is gonna take a whole community response with partners that we might not traditionally work with. But they need to be at the table. They have lots of knowledge and expertise, and in many places they've already rolled up their sleeves and gotten to work. As the lead federal agency for the Zika response, HHS's first priority, as you've heard, is to reduce the risk of Zika to a pregnant woman or her developing fetus, and to women who may become pregnant. We have a three-part strategy to prevent, detect, and if necessary, to respond, to address the needs of those infected with Zika or complications of that virus. This strategy requires a variety of approaches: development of better diagnostic tests and a vaccine, guidance and communication about the risks to healthcare providers, pregnant women and their partners, women of childbearing age who may or may not be planning to become pregnant, and to the public, including men. We talk a lot about women. Men have a role in this too. Amy talked about being the mother of 2 girls. I'm the mother of 3 boys. So I'm acutely aware of their roles. In addition to that, obviously you've heard about vector control, surveillance, increasing laboratory capacity, and healthcare system preparedness to treat people with complications of Zika, care for children born with birth defects or other conditions that might be associated with Zika, as well as for women who wish to avoid becoming pregnant to continue to engage. At a federal level, HHS has continued to engage the public and healthcare providers to be sure they have correct information about Zika virus, its risks, and how to protect themselves and their patients. As I think you probably saw from the news this week, there is still a substantial proportion of the public that's got a lot to learn about Zika virus and how it's transmitted. We've prioritized research to better understand the virus's potential association with birth defects and neurological disorders. And as we did for Ebola, we jump-started our medical countermeasure development enterprise to develop better, faster Zika diagnostic tests as quickly as possible and safe and effective vaccines, which will take more time, but work is underway, and we are not taking our foot off the gas pedal there. Because there's already mosquito-borne transmission in Puerto Rico and American Samoa and the U.S. Virgin Islands, we're working intensively there, including efforts on vector control, and you'll hear a lot about that today, screening blood to ensure that it doesn't become a source of transmission, and ensuring that women of childbearing age who don't want to become pregnant have access to effective contraception. We will use what we are learning about combating Zika in Puerto Rico and the other territories to inform our preparedness and response efforts in the rest of the country. And I think for those of you who are here today, you have already great experience in Puerto Rico and the U.S. Virgin Islands. And I urge you to talk to colleagues from there, hear what they've been dealing with, and learn from them and their experiences. We'll continue to work with you, our state, local, tribal, territorial partners, and with Congress to support planning and implementation of these major strategies in your communities, which is, of course, what today is all about. As I think many of you have heard me say before, preparedness and good response are built on the back of strong everyday systems. So I hope that today's activities help you link to key federal agencies, assets, and expertise that are in place every day to help you develop your plans. And at the end of the day, some of those day-to-day activities that need to be stronger, like our vector control system in the United States, like access to contraception in areas where it's not widely available and those things, we hope that at the end of the day, we will leave those strong day-to-day systems in our country better off than we found them, because as Dr. Frieden said, the only thing that's predictable here is another infectious disease to follow. So I hope you have a great day. I hope it's really productive, and thanks for being here.
Before we begin the science plenary, we thought it would take a moment to recognize all of you. Currently, we have approximately 2,000 people that have registered that are watching our live webcast. In addition to that, there are 178 state, tribal, local, and territorial participants in person in Atlanta today. Additionally, we're very pleased to have 24 different non-governmental organizations that are participating and supporting our Zika Action Planning Summit. We hope that you'll have a chance to connect with each other and share information about all of the great resources that are available from these non-governmental organizations. In addition to that, we have 20 different U.S. government, department, and agencies that are in attendance also to support the Zika Action Planning Summit and are available as subject matter experts and will be participating throughout the summit with all of you in our action planning sessions and in our leadership planning tracks.